I'm particularly proud to hear about your announcement earlier today about former governor from Kansas, Jeff Colyer, to head up the HHS rural health initiatives. Our former governor and a medical doctor, Kansans know that Dr. Colyer is dedicated to rural America and to patient well-being. I can personally attest to his qualifications and know that he's very fit for this initiative. Can you help talk through a little bit about how you want to make sure that there's a major focus on rural health care in America with this initiative?
Absolutely. So we really have 4 parts to our rural health care strategy, which involves, first, we've got to get an economically sustainable model. Just as I was talking with Congressman Evans about, it's about we can't paper over facilities if the economic model doesn't work. We've got to make them work. So part of that was changing the wage index to redirect monies to rural hospitals. But then how do we make them actually sustainable? One of the budget proposals that I'm really excited about is to stop rural hospital closures is the critical access hospital plan that would let you switch to be an emergency room and outpatient and not have to be inpatient, as well as get you supplemental payments to enhance that work. So that for hospitals would be a great part of it. So that's a part of it. Happy to go into more detail, but I don't want to use up all your time.
Okay, great, thank you, because there are some different initiatives and different hospitals that maybe have a different footprint in terms of how they were built, and changes in the community over time have had a major change. I do want to follow up with one other comment while I still have some time, is that we know you've been working a lot. We've talked a lot this morning about the COVID-19, and it's critical that those rural areas also have access to protections against that, and want to make sure that the funding gets out to that rural areas as well. I mean, maybe it needs to be as much as 25% or even more of the funding to help make sure that it covers those rural areas and not just the urban areas. Particularly, I mean, using the telemedicine, being able to prepare for staff shortages, being able to address overflows from some of the urban areas that are critically hit in terms of when the crisis does hit. So I don't know if you've had some time to look through as you're working through this, is what are you looking at in terms of helping make sure the rural hospitals and providers can help be part of this plan?
As we work together on an emergency sup on money that would go to states, I think it's important that we make sure that gets out there, because the states make so many decisions. So that'll be criteria we work on with you all.
Thanks, Secretary.
Thank the gentleman. Let me recognize the gentleman.